Hey everyone, welcome back for another deep dive. As microbiologists, we think we've got it all figured out. We've seen it all.
Right. Like what could possibly surprise us?
Well, today, I think we're going to dig into something that might just challenge that. We're talking about cellulitis.
Cellulitis, huh? Yeah, we see it all the time.
Exactly. But I think there's some layers here that even seasoned microbiologists might find interesting. We've got some great info from Microbiology, the CDC, and even Microbe Canvas that we're going to unpack today.
Sounds good.
Okay, so let's start with the basics. What exactly are we dealing with when we say cellulitis?
Well, I think Microbiology puts it pretty clearly. It's a bacterial infection.
Okay, an infection, that makes sense. But is it like any skin infection?
Not exactly. Cellulitis specifically affects the deeper layers of the skin.
Deeper layers. Okay, so we're talking like the dermis and the subcutaneous fat.
Exactly. That's what makes it different from something like erysipelas, which is more superficial.
So it's not just a surface level thing. This goes deeper.
Yep. It can be tricky to tell them apart in practice, though. They often look very similar, which can make diagnosis a challenge.
I can imagine. So if it's a bacterial infection, what kind of bacteria are usually the culprits here?
Well, the usual suspects are Group A Streptococcus and Staphylococcus aureus.
The classics. Group A strep and Staph aureus.
But here's the thing. They're often part of the normal skin flora.
Yeah, that's right. They hang out on our skin all the time.
But when they get beneath the skin, through a break or a cut...
That's when they cause problems.
Exactly.
And I'm guessing the specific bacteria, especially if it's Staph aureus, can really influence treatment decisions.
Oh, absolutely. Especially with the rise of MRSA, methicillin-resistant Staph aureus. Knowing if it's MRSA or not changes how we approach treatment.
Makes sense. So let's talk about symptoms. What should we be looking for?
Well, I think everyone knows the classic sign of cellulitis.
Redness.
Yeah, redness. But it's not just any redness. It usually spreads, and the borders are kind of blurry, not sharply defined.
Okay, so we're looking for spreading redness with poorly defined borders. What else?
Usually there's swelling and pain in the area, too.
That makes sense.
And typically you'd expect the redness to turn white when you press on it, but that's not always the case.
Oh, really? So we can't rely on their blanching sign every time?
Not necessarily. It can be a bit misleading sometimes.
So diagnosing cellulitis can be tricky. It's not always straightforward.
Yeah, a lot of times it comes down to the patient's history and a good physical examination.
Makes sense. So we've talked about the skin, but can cellulitis affect other parts of the body too?
It can, yeah.
What do we see?
Sometimes the lymphatics can be involved. And patients might also have more general symptoms like fever or feeling tired.
Fever and fatigue, okay.
Which makes sense, right?
Yeah, it's an infection after all.
And although it can show up anywhere, cellulitis most often pops up on the legs, especially after some kind of skin break, like a cut or a scrape.
Okay, legs are a common sight.
Except for facial cellulitis. That one's different. It usually doesn't involve a skin break at all.
That is interesting. So we really do need to consider the location.
Absolutely. And it's important to remember that cellulitis can have some serious complications.
Okay, let's talk about those. What are the potential complications?
Well, for starters, you can get abscess formation.
Yeah, those are never fun.
You can also see fasciitis or even sepsis in some cases.
And sepsis, obviously, is a big concern.
Definitely. But here's something that's kind of surprising. Even when the infection gets into the bloodstream, blood cultures are rarely positive.
Really? Why is that? You'd think if it's in the blood, it would show up in a culture.
It's a bit of a mystery. Some theories suggest the bacteria get cleared from the blood quickly, or maybe our immune system hides them away in tissues so they're harder to detect.
Huh, that's fascinating. And a little unsettling.
It is. It just goes to show that clinical judgment is super important in these cases. You can't always rely on the lab tests alone.
I agree. So what about that really scary complication, necrotizing fasciitis?
Ah, yes. The infamous flesh-eating bacteria we hear about in the news. It's definitely a serious situation, a true medical emergency.
Okay, that sounds terrifying. What are the signs we should be looking out for?
Well, imagine someone comes in with cellulitis that's spreading really quickly, and they have intense pain, way more than you'd expect from how the skin looks. That's a major red flag.
So rapid spread and pain out of proportion to the visible signs. Got it.
Exactly. If you see that, you need to act fast.
Okay, that's enough to give anyone nightmares. Let's shift gears a bit and talk about treatment. How do we tackle this beast?
Well, antibiotics are the key, obviously, but the specific choice depends on a few things.
Like what?
Well, what's available in your region for one thing, but also what bacteria we think is causing the infection.
Right. So if it's a simple case, What's the usual go-to?
Generally, we recommend a penicillinase-resistant semisynthetic penicillin, or sometimes a first-generation cephalosporin.
Okay. I'm guessing that changes if we suspect it's a staph infection.
Absolutely, especially if there are abscesses, furuncles, or carbuncles involved.
That makes sense. You need something that can handle those penicillinase-producing staph.
Exactly. Those penicillinase-resistant options are crucial in those cases. And if we're dealing with MRSA, then we need to consider other antibiotics altogether, like vancomycin or clindamycin.
So it sounds like there's a lot to consider when treating cellulitis.
There is. It's not as simple as it might seem at first glance.
Well, I think this deep dive has been a great reminder that even with something as common as cellulitis, there are always new things to learn and consider.
I agree. And it makes you think, with antibiotic resistance becoming more and more of a problem, what's next for treating cellulitis?
What new approaches will we need to develop?
Yeah, will we see more targeted therapies, like maybe using bacteriophages or some of those new antimicrobial peptides?
Or maybe we need to focus on prevention strategies.
Like figuring out how to boost the skin's natural defenses.
Those are definitely questions worth pondering. Well, on that note, I think we'll wrap up our deep dive for today.
Thanks for having me. This was really interesting.
And thanks to all of you for listening. Don't forget to check out Microbiology, the CDC, and a microbe canvas for more information on cellulitis. Until next time.